world has been taken by storm by this coronavirus, which has so far killed over 550 people and has spread to over 15 countries. There are so many questions out there as to how coronavirus is spread, how you know you actually have coronavirus, what the signs and symptoms are. Don't worry, I've got you today, because today we will be talking to health specialists who will enlighten us more on what coronavirus is, what the signs and symptoms are, what you need to do if you suspect that you have coronavirus. Stay tuned. So now we are joined by the Director of Health Services, Dr. Prosper Chonzi. Doctor, thank you for joining us.
Thank you very much for having me.
So doctor, can you please enlighten us on what coronavirus is? What is coronavirus?
Yes, coronavirus, this is a family of viruses that cause from the common cold that you normally see or experience every day to the very severe disease like the one we are talking about now. So your flu to SARS through to the coronavirus infection, which ends up with people having severe respiratory distress. They go into shock and they die. It derives its name from, when you look at it under a microscope at the virus, it's got a crown sort of, so that's why it's called coronavirus. It's not a new virus. It has been in existence since the 1960s. That's when it was identified. But it has, of course, evolved over time. This type that we are talking about is a new one in the family. It's called 2019 novel coronavirus. That's the name that it's going by right now. So it is spread by what we call droplet infection. The same way you get a cold, isn't it? Somebody who is seated next to you, they cough or they sneeze, they introduce the virus into the atmosphere, into the air, you breathe it in. They sneeze, it's probably they sneeze onto something, a glass, a towel, or a door handle. You touch the door handle, and you touch your nose, you touch your mouth. That's how it is spread from person to person. Normally, these viruses are restricted to animals. They are normally in bats and wild animals. But with time and the connection between animals and people, you now find that the virus has moved from animal to person, then now it's from person to person. This is the stage at which we are now.
Oh, this one. I was about to ask where it is coming from. So basically we're saying it is coming from animals.
There are a number of theories.
Okay.
You remember the time when we had HIV, who were saying, where is it coming from? And then they said, no, it's coming from the apes, the African green monkeys and all. And it was mostly to do with close contact between those apes and human beings. So this particular one, it is postulated that it is coming from bats. People are now eating all sorts of things. I mean, like if you have your bat soup, if you have your snake soup, if you have all these things that people are eating now, and some are being eaten raw. And once these things happen, the virus, which was in a hostile environment in the wild animal, will find a more accommodating environment in a human being, because our systems are not as strong as the systems in the animals. So we think now that this one is actually coming from people eating or consuming these raw or undercooked or uncooked animal meats, and the close contact between animals and humans.
No, so I've been having a cold. Should I be worried? What are the symptoms of coronavirus?
Okay. So the symptoms really are the ones that they start off with your common cold. You might have your runny nose, you have your sore throat, you may have a headache, you may have a fever as it progresses, your general body weakness, where you feel I'm not well. But then it progresses rapidly to causing severe respiratory distress with a high fever. And then once you are in severe respiratory distress, you are not perfusing your whole body with the oxygen that is needed for your brain, for your other organs. So you end up in distress, and it will proceed either to it starts off as an upper respiratory infection, but it can then go into a lower respiratory. The lower respiratory, that's the one that involves the lungs. The upper respiratory is normally the trachea and the bronchi, and up there your nose, but if it becomes lower, it then goes into the lungs and it becomes pneumonia. The pneumonia can become very severe, and then the patient becomes hypoxic. There's no oxygen circulating. They go into coma and they die. So those are the symptoms, and this disease is an incubation period. So if you get it today, if you do get infected today, it will take you about 6 to 7 days, or maybe let's say 4 to 7 days. Within those 4 to 7 days, we expect you to have exhibited symptoms. Either you have a running nose, you have a cough, you have... Within this 4 to 7 days, that's the incubation period. But when we are doing surveillance, I'm sure we'll talk about surveillance later on, we put you under surveillance for 14 days. This is like 2 incubation periods. If you don't fall sick within the 14 days, even if you had been exposed, then it means you do not have, or you're highly unlikely to be having the disease. That's why you put people under surveillance for 14 days.
So after this surveillance system, is there a cure to it?
No. For now, there is no cure. For now, there is no vaccine. As with common colds, we expect the body normally within 3 to 5 days. If you are sick, within 3 to 5 days, if you have a common cold, of course it may be uncomfortable. It can cause a lot of discomfort within the 3 to 5 days. But your body will find a way of dealing with your common cold. That's how the body deals with viral infections. There are no antivirals, so to speak. We do have a bit of interferon in this that can help the body to work against viruses. But normally, the body takes care of itself. What you give is supportive therapy. That's why I say, hey, drink a lot of fluids, eat fruits, stay at home, just relax, rest, then the body will take care of itself. That's normally what happens. So with this particular one, because of its severity, it will not allow the body to take care of itself. That's why you see we then progress and you eventually die. But if you look at the figures right now, we've had over 20,000 cases, confirmed actually, mostly in China, of course.
Yes.
But of those 20,000, you only have maybe 400, 500 deaths. It means 19,000 are recovering. It means the body itself will fight. The people that are succumbing to this virus, the coronavirus that we're talking about, 2019 novel coronavirus, are those that have other comorbidities. So if you have heart disease, for instance, if you are immunocompromised for one reason or another, it may be HIV, it may be due to diabetes, it may be due to some cancer somewhere, already you have a condition. And then when you get this virus, it shakes your body, and then those conditions might then accelerate the pace at which, the time within which you will die. But otherwise, we expect the body to take care of itself.
You did mention the issue of oxygen. So does that mean that if I contract the coronavirus, I can get the oxygen? I can go on oxygen as we would like to go. Then how to say?
So what happens with the oxygen bit? Normally, in ambient air, you probably have 21% oxygen in this environment. So what you're breathing in into your system is around 21, and it's enough. With good circulation, it goes into your lungs, goes into your heart, and the oxygen is in the lungs, so the blood is circulating, and it gives oxygen throughout the body, the 21%. But with this, because you now have infection all over, your lungs are no longer able to absorb the 21%, you need more. That's why we give you oxygen support. We may then have to give you oxygen per face mask, or we may put you in a room with piped oxygen and you just have a face mask or nasal probe. So the oxygen is towards the end, when you are really in distress. That's when we give. Currently, we do not have any cases in Zimbabwe. We do not have any cases in Africa as we speak. Maybe let me define by case what I mean. if somebody is coming from a country, maybe they are coming from China, which is a country that we call reporting country for coronavirus. So there are cases in China, mostly in Wuhan province. So if you're coming from that area and you come to Zimbabwe through maybe our designated ports, the airport, you are a traveler coming from this province, which we know is reported cases into Zimbabwe. So we will have to, there are people coming there who are not infected. There are people coming from there who may be infected. That's why we do the check at the airport, where we screen. Of course, we have to take a history. Where are you coming from? Are you coming from this area? Where exactly are you coming from? So that we get a detailed history of the potential patient. We have that thermometer that we use at the airport, that's sort of like a gun. It checks your temperature. This disease, when you start falling sick with this disease, you will definitely run a temperature. 38, 39, sometimes even 40 degrees. So this will pick it up. So now there are two issues. You're coming from China, you're coming from Wuhan province, and you are running a temperature. And maybe you also have a cough, a running nose, and a sore throat, you see. So putting all those things together, we then suspect that you may have coronavirus. Then we'll put you aside and we'll quarantine you, we'll isolate you from the rest of the passengers. Yeah? But if you're coming from China, maybe not Yuan province, you come through the airport, you are not sick, there's nothing wrong, we check your temperature, there's nothing wrong, we will not isolate you, we'll let you go, but you give us all your details. Where exactly are you coming from? Where exactly are you going? Where are you going to be staying? So we then say, because of the incubation period that I talked about earlier on, we want to put you under surveillance. You are not isolated, but we want to put you under surveillance at your home. So we come to your place every day to check your temperature and check if you are having those symptoms that I mentioned earlier on. Once you start exhibiting those symptoms and once you start having a temperature or a fever, then we say, now we take you away from everybody else and bring you to an isolation facility. In this case, for Harare, it will be now to Wilkins Hospital, and we'll keep you there. You see, so that's the natural. So when we say we are managing cases, we mean that is how patients with the virus are looked after.
So yeah, generally as a country, we have people who are experiencing colds here and then. Probably I am experiencing one at the moment.
Yeah.
Should I be worried? And how do I protect myself? Where do I go? Or is it still too early for us to be getting worried?
No. Well, there is no reason for you to panic, and there is no. You also are allowed by nature to have a cold. There's nothing wrong with you having a cold. There's nothing wrong, but there's got to be a positive history or a positive link, with what we call in medicine an epidemiological link with somebody who has had the disease. So when you have not traveled to these areas where the disease is currently happening, if you have not been in contact with a person who has been there, you've just been in Zimbabwe, in Harare, minding your business, and there is no problem for you. You can have a cold, and I can guarantee you, within 3 to 5 days, your body should have recovered. But if you know that you have been in contact with somebody who has been out there, and you start having these symptoms, what we encourage, without necessarily panicking yourself, is for you to go and see a doctor. They will take you through, they will take a good history, they will examine you, and they will tell you, no, don't worry. And for now, most of our patients, there's really nothing to worry about.
So our viewers are more concerned with the issue of how prepared are we as a country to handle this virus, considering that it has been called to be a world health emergency at the moment. Are we really prepared?
So I think the things that WHO considers before they declare something, a condition, a public health emergency of international concern, firstly, they look at the severity of the disease. How does it, when people get it, how many die? So we look at the mortality patterns. You also look at the potential for spread. How is it spread? How fast is it spread from one person to the next? And then the third thing is they look at the capacity of international community to deal with a condition of this nature. So they have looked at that. Of course, it spreads very fast. It also has the capacity to kill, and also, especially in the resource-poor settings, dealing with this is a major problem. As Zimbabwe, what we do, firstly, is we don't want to get the condition, we don't want it to come into Zimbabwe. That is why you see we are trying to be as vigilant as possible in our ports of entry. Our Harare International Airport, our Victoria Falls Airport, and Bulawayo. But there are also other ports, Beitbridge, there is Chirundu, where we have a lot of traffic. So right now we are in the process of making sure that our port health officers, at every port there is a health officer. So our port health officers are firstly capacitated to deal with the number of travelers that are coming in. They check for the symptoms, they check for like I earlier on said. Then if there's somebody, we put them under surveillance. If there is need, we then quarantine them, isolate them. The local authorities, like Harare, are mandated by the Public Health Act and Urban Councils Act to isolate patients with infectious conditions. That's why in Harare we have two. We have Beatrice Road Infectious Disease Hospital along Beatrice Road. We have Wilkins Infectious Disease Hospital in Milton Park. That's why when there are outbreaks of cholera, we are the ones who deal with them. Outbreaks of diarrhea, TB, and all, we manage them in these institutions. We do not want a patient with TB to be admitted at Harare Hospital or Pari, because they will spread the disease to somebody who goes in there with a fracture. So, in terms of isolation facilities, we have these two. But for this corona one, we have designated Wilkins Hospital to be the isolation facility that we are going to be using. This we have experienced, that's the one we were using in 2014 when we had an Ebola scare. So we have been preparing, we do drills every day. There's currently some Ebola cases in the Congo. So we cannot afford to relax because any time we can have a patient. So we have been doing drills. Our teams that will then respond are already there in place. We just needed to refresh ourselves on this new condition. Otherwise, the drills are more or less the same. The isolation facilities for now are ready. We have an ambulance crew that will be ready to pick up anyone, airports, wherever, in the suburbs, bring them to Wilkins. The ambulance crews are trained. They have protective equipment. You see them. We have these aprons, we have these space suits. All those are in place. And we have been using them as we're doing our drills. So the ambulance crews will be protected. Then the crews at the Wilkins Hospital will be protected. There are 7 teams, and they work for 6 hours. So you go in there into the facility, you work for 6 hours. Should we have a case, we will close off Wilkins to any other condition but corona. So if you have corona, we will go to Wilkins. Any other patients will be moved to Beatrice Road. So if we have a case now, the ambulance crew is ready. It's led by a doctor who is also very well trained in highly formidable diseases. Our teams actually have 17 doctors at Wilkins just there, and all the teams are nurses and all. And the training does not just apply to the health workers, it applies to everyone who will be working in the streets. So you find we've been training everyone, from the security guard at the gates, to make sure that he also appreciates the condition, he knows what to do and what not to do. Then the cleaners, they are very exposed because there is also a lot of medical waste, so if they don't know how to dispose of it, they will have problems. Then you also have the morticians, those that work in the mortuary, the funeral parlors. We've had to train all of them so that it's a whole value chain. And these ones have been trained, but the trainings are ongoing. Right now we have upped our game in terms of training and capacity building. So yeah, we do have an isolation facility, we do have teams that are ready to respond, we do have surveillance systems at our ports of entry, and our motto is we want to stay safe and we want to stay healthy and then protect the next person. So if you are in a community and you are feeling unwell, we would encourage you to self-quarantine. Don't then go to church and sing loudest when you know you have this condition. Not necessarily corona, but even your common cold. You want to protect your kids, you want to protect your neighbors. But you must stay safe. So these are the measures that we want you to take. But if you have traveled to these areas, we really want you to submit yourself to ourselves so that we can thoroughly interrogate your health and assist you where you need the help.
So at what point is coronavirus infectious?
So coronavirus, and this has now been recently established. Before, people thought that you could actually spread before you become symptomatic. But that has been dispelled, I think, a couple of days ago.
Okay.
You have to be symptomatic for you to then spread it. Remember, this is by droplet infection. Droplet infection is when you cough out. So this is something that you have, you introduce it into community, but you can't introduce it into the atmosphere if you don't have symptoms. Because already the cough is a symptom, your runny nose is a symptom, so you have to exhibit symptoms before you can infect the next person. The next person can be infected directly by inhaling your cough particles, or you can then touch your mouth after touching whatever you would have coughed into or sneezed into. So really, good personal hygiene, good cough hygiene are the messages that we then want to send out there. When you're coughing, just cover your mouth, your nose, and you can cough. Dispose of, if it's a tissue paper, dispose of it as soon as you use it. And if you are sick, stay at home. Eat well, drink well, but protect your other family members and protect the rest of the community.
Are there any challenges in responding to the coronavirus?
Yes, thank you very much for that. When you are responding to an outbreak, especially one of public health importance, national and international, you do need a lot of resources. Human, material, financial resources to respond. If you just look at the various levels that I was talking about, if it's surveillance, we start with the port health. You need people there to start screening. But when you have identified those that you want under surveillance, you need to follow them up on a daily basis for the 14 days. So you need a lot of things. You need transport, you need fuel, you need personnel to go and do that. Then when they have exhibited symptoms, you want to admit them in hospital. Of course, for now, we have protective wear. But if the outbreak really does get out of hand, you will need a lot more. So we need to mobilize before we get a case and before we are overwhelmed with cases. We need to have loads and loads of protective wear, your gloves, your aprons, your spacesuits, your goggles, and all. So those are the kind of things that we would then want the international community, particularly WHO and other partners from the UN family, to be able to provide for us so that we get better prepared. We need also to motivate those people that will be working around us. This is a highly infectious disease. You don't expect any nurse to just say, I want. These are motivated nurses and doctors who need to be trained, and training is not cheap, and you're training everyone. So these are some of the resources that are really constraining us at the moment, but we're trying to work, of course, using internal resources, but I think now is the time to, as we start preparing for bigger things, we may want to ask a lot of our friends and colleagues to chip in with those. At the moment in Zimbabwe, I think I want to say that again. In Zimbabwe, we do not have any cases. We do not have any confirmed case. We do not have any suspected case. What we have are travelers who are under surveillance. See if in Southern Africa there are no cases. The ones that were suspected to have been cases in Botswana, the 5, they've just issued yesterday. They just issued a communique saying that those are negative. There were suspected cases in other places, Angola and all. So those again were all negative. It's good to have suspected cases in this instance because it will, and then you prove that they are negative. It will give us comfort as public health specialists because we cannot say there is nothing coming into you given all this trouble. But testing them and finding that they are negative will give us the comfort that we are now living in. We know we have tested, we send our specimens, of course, to South Africa, but the results are coming back negative. But in Zimbabwe, we have not even had a suspected case. This is our situation currently.
No, that's a relief, doctor. Thank you.
So there you have it, ladies and gentlemen. We were just talking to Dr. Chonzi, who was giving us an insight in what coronavirus is, the symptoms, the signs of coronavirus. If you have a cold and it lapses in the 3 to 5 days in which you're supposed to have subdued, you are supposed to go and check out with your doctor, in which case you might have the coronavirus. But then the doctor did emphasize that if you have not had contact with anyone from the regions where the coronavirus is coming from, in this case from China Wuhan district, do not be worried, it will probably just a cold. I'm Margaret Matibui signing off.